Coronavirus is going to cause a viral pneumonia, and the severity of that pneumonia can range from pretty mild all the way up to fulminant respiratory failure and severe problems. When people develop acute respiratory distress syndrome, which can happen for a whole variety of reasons besides just COVID-19, the average mortality is about 25 to 30% in all comers. What we've seen in this outbreak of the virus, however, is that for people who get severe air deaths, the mortality seems to be much, much higher. And for many people, spending long periods of time on the ventilator. Many of them will not survive. We've had cases down here as young as 31 years of age at our hospital. And the people who are getting this at younger ages, in their 30s and their 40s, are getting just as severe disease in some cases as the older individuals who have comorbidities. So I don't think this virus is sparing the young.
We talked about potentially proning him last night. However, after calling his family, they were concerned that he's very sick and will not make it out of the hospital. So they're still sort of processing that, so we held off on proning.
The hospital has done a lot of planning to get ready for a surge of patients. We've created a dedicated ICU for caring for patients with COVID-19, as well as for patients who need to be ruled out for that when they come in and there's a high suspicion that they're infected. Once we have over a certain number of COVID positive patients in our COVID ICU, we activate a second attending physician who works primarily in that unit along with the residents from the regular medical ICU team. But the team has to share the work, and you can imagine that the disruption in workflow is pretty significant, adds a lot of time to the day. And then just the care of patients with COVID-19, or even who are just being ruled out for COVID-19, is much more time consuming than it would be for the care of other patients. Simply going in and out of the room takes more time because of the donning and the doffing of the personal protective equipment in order to keep yourself as well as the other staff safe.
And then the one thing I would add, if he does decompensate from the
Now, one of the things I actually find under normal circumstances that's the most rewarding aspect of this job is the interactions with the patients and their families. And that's been completely overturned in the current pandemic. We spend as little time in the room as possible to decrease the risk of exposure to the virus and help preserve personal protective equipment. So even for patients who are not intubated and are able to talk, we don't have as much of the face-to-face interaction with them. And for families, it's been particularly challenging. The hospital has significantly restricted family member or friend access in order to decrease the risk of spread of the virus. So we are forced to have all conversations over the phone with the family.
70%, a rate of 12 is where I had him, and overnight he got, I think one of the nurses turned him up, and he's on 100% and 12 with beef right now, so I can adjust that.
The people who really deserve everyone's thanks these days are the nurses and the respiratory therapists and the other staff that are working in the hospital. Because while we're spending a lot of time in the ICU, it's the nurses who spend a huge amount of time at the patient's bedside. They're the ones that are facing the greatest risk. All right, orders and plan. I think the federal response has been terrible. It's been haphazard. The communication's been poor. Everyone knows about the delays in kind of recognizing the severity of the situation. Concerns that they actually knew earlier on that things were going to be severe but didn't act on that and take any measures to help protect the country in that situation. And then everything that's transpired since that time, I think, has just not been conducted very well. And I think if it wasn't really for the actions of the state and local leaders, not just in Washington but elsewhere in this country, I think this pandemic would be a lot worse. And I'd say in the last week or two, we've seen kind of a slow, steady rise in the number of patients, which kind of seems to be a little bit of, at least maybe a harbinger of what's to come as we go into the next couple of weeks. And I really fear that we'll see a significant increase in the number of cases in this area that will put a similar stress on the system and then impair our ability to not only take care of the patients, but safely take care of ourselves. I haven't had to make a decision about working in the absence of PPE. It's definitely in the back of everyone's mind. And we know that they're working very hard to maintain the supply of PPE for us so we can continue to deliver care in a safe manner. But I think I'd be lying if I told you that staff weren't worried about shortages of that and then what implications it will have on our ability to keep ourselves healthy. one of the things I've experienced that I think all of my colleagues are experiencing now, there's so much fear of contracting the virus. Every time you have the slightest little physical symptom, so there's a little scratch in my throat or my nose ran a little bit today and I just had to pull out a piece of Kleenex, there's this thought that, you know, this is it, this is the COVID-19 and oh, everything's going to go downhill from here, and you have to just be willing to take a deep breath and move forward and accept the risk. Otherwise, you won't be able to do the things that you need to do for the sake of the patients.